Welcome to the Victory Education Lounge, everyone. I'm your host, Maurice, and today we're diving into a crucial topic that affects millions worldwide: malaria. Before we begin, please take a moment to like this video, subscribe to our channel, and leave a comment below sharing your thoughts or experiences with malaria. Your engagement helps us reach more people with this vital information. Here at the Victory Education Lounge, we're all about empowering you with knowledge, one video at a time. As we venture into this series, we invite you to join us, learn with us, and share your insights with us. Now, let's get started. What comes to mind when you hear the word malaria? Maybe you think of mosquitoes, fevers, or tropical regions. Perhaps you're aware it's a serious illness, but the specifics are a little blurry. Whatever your current understanding, we're here to shed light on this complex disease. Malaria, in its simplest definition, is a life-threatening disease caused by parasites that are transmitted to people through the bites of infected female Anopheles mosquitoes. It's not just a simple mosquito bite, it's a complex cycle of infection, multiplication, and invasion of our red blood cells by these parasites. Understanding the different species of the malaria parasite is crucial. There are 5 species that can infect humans, and among them, Plasmodium falciparum is the most deadly. It's this species that's responsible for the majority of malaria-related deaths worldwide. The symptoms of malaria can range from mild to severe, and in extreme cases, can lead to death. Common symptoms include fever, chills, headache, and muscle pain, which are caused by the parasite's life cycle in our red blood cells. So, how can we manage, treat, and prevent malaria? Treatment typically involves a combination of antimalarial drugs. However, drug resistance is a growing issue, particularly with Plasmodium falciparum, making treatment more challenging. Prevention methods include using insecticide-treated mosquito nets and, more recently, vaccination. While the first malaria vaccine shows promise, it's not 100% effective and requires multiple doses. In this first part of our malaria series, we've broken down the basics: what you need to know to understand this disease and protect yourself and your loved ones. But this is just the tip of the iceberg. Stick with us as we delve deeper into each aspect of malaria in the subsequent videos, arming you with the knowledge to safeguard yourself and those around you against this global health threat. Malaria is caused by Plasmodium parasites, which are transmitted to humans through the bites of infected female Anopheles mosquitoes. These tiny, pesky creatures are more than a mere annoyance. They're the carriers of a parasite that's responsible for one of the most devastating diseases known to mankind. Now, let's get a bit more specific. There are 5 species of Plasmodium that can infect humans, namely Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, and Plasmodium knowlesi. Among these, Plasmodium falciparum is the most deadly, causing the majority of malaria deaths worldwide. Here's how the process works. When an infected female Anopheles mosquito bites a human, it injects the Plasmodium parasites into the person's bloodstream. These parasites then travel to the liver, where they mature and multiply. After a period of 1 to 2 weeks, the mature parasites leave the liver and begin to invade the red blood cells in the bloodstream. Once inside the red blood cells, the parasites continue to multiply, causing the cells to burst open and release more parasites into the bloodstream. This cycle of invasion, multiplication, and release repeats every 2 to 3 days, leading to a massive increase in the number of parasites in the body. This cycle of invasion, multiplication, and release from red blood cells is what causes the symptoms of malaria. The bursting of red blood cells triggers bouts of fever, chills, sweating, and other symptoms. More severe symptoms, such as anemia and organ failure, can occur when large numbers of red blood cells are destroyed or when the parasites clog small blood vessels. So in essence, malaria is a vicious cycle of infection, multiplication, and destruction, and it all starts with a tiny bite from an infected mosquito. But remember, knowledge is power. By understanding the cause of malaria, we are better equipped to prevent it and protect ourselves and our loved ones. You might experience fever, chills, headaches, and muscle pain. In severe cases, malaria can lead to complications like organ failure, seizures, or even death. So, what does malaria feel like? Well, the symptoms usually start 10 to 15 days after the infective mosquito bite. Initially, you might feel a bit like you have the flu. Along with the fever and chills, you could have a headache, muscle aches, tiredness, and even nausea or vomiting. As the disease progresses, symptoms can become more severe. You might develop anemia due to destruction of red blood cells, or jaundice as a result of liver damage. In the worst cases, malaria can cause kidney failure, seizures, mental confusion, and even coma or death. the range of symptoms is vast, and they can vary greatly from person to person. That's why it's so important to seek medical attention if you suspect you've been exposed to malaria. Now let's talk about solutions, management, and prevention. First, how do we manage malaria? The most common treatment involves a combination of antimalarial drugs, such as artemisinin-based combination therapies, or ACTs. These drugs are designed to attack the malaria parasite at different stages of its life cycle in the human body, effectively halting the disease in its tracks. But it's not as simple as just taking a pill and calling it a day. To effectively combat malaria, the treatment must be tailored to the individual patient. This means taking into account factors like the species of malaria parasite causing the infection, the patient's age and general health, and whether the patient is pregnant. It's a complex process that requires a comprehensive approach. Now let's talk about those antimalarial drugs in more detail. ACTs, for instance, have proven to be very effective in treating malaria. They work by rapidly reducing the number of parasites in the blood, relieving symptoms and preventing complications. However, they're not a one-size-fits-all solution. One of the challenges we're facing is the rise of drug-resistant strains of malaria. This is especially a problem with Plasmodium falciparum, the deadliest species of malaria parasite. In some parts of the world, this parasite has developed resistance to nearly all available antimalarial drugs, making treatment much more difficult. Drug resistance is a serious issue, and it's one that scientists and health professionals are working hard to tackle. There are new drugs in development and ongoing research into ways to overcome resistance. But for now, it remains a significant hurdle in the fight against malaria. So, what does this all mean for the management and treatment of malaria? Well, it means that while we have effective tools at our disposal, there's still a lot of work to be done. It means that every case of malaria needs to be carefully managed to ensure the best possible outcome for the patient. On the cons side, antimalarial drugs can be expensive, and access to these drugs is limited in some parts of the world. Moreover, the risk of drug resistance is a significant concern. But with continued research and global efforts, we're hopeful for a malaria-free future. Prevention is crucial. One of the most effective preventive measures is the use of insecticide-treated mosquito nets. These nets serve as a physical barrier against mosquitoes, particularly during the night when the insects are most active. They're also treated with insecticides that not only kill mosquitoes but also repel them, providing a double layer of protection. These nets are simple to use. Just hang them over your sleeping area and make sure they're tucked under your mattress or sleeping mat to prevent mosquitoes from getting inside. They're also relatively inexpensive and can last for several years if properly taken care of. However, over time the insecticides can wear off, and the nets can develop holes, reducing their effectiveness. In some areas, mosquitoes have also developed resistance to the insecticides used on these nets. Another preventive measure is indoor residual spraying, or IRS. This involves spraying the inside walls and ceilings of homes with insecticides. Mosquitoes that land on these surfaces are killed, reducing the overall mosquito population and interrupting the transmission of malaria. This method is effective, but can be costly and requires trained personnel to carry out. Then there's the preventive method that we've all been waiting for, the vaccine. The RTS-S/ACE01 vaccine, also known as Mosquirix, has shown promise in reducing the incidence of malaria. This vaccine works by triggering the immune system to attack the malaria parasite, preventing it from infecting, surviving, and multiplying in the liver. While this vaccine provides hope, it's not a silver bullet. It's not 100% effective, and it requires 4 doses to be administered over a period of 18 months, which can be challenging in remote or resource-limited settings. Additionally, it's currently approved for use only in young children, and its availability is limited. These preventive measures, combined with ongoing efforts to improve access to diagnostic testing and treatment, are crucial in the global fight against malaria. Remember, prevention is always better than cure, and in the case of malaria, it can be a lifesaver. The downside? It requires multiple doses, and its availability is still limited. Let's take a look at the global impact of malaria. This disease is not just a health issue, it's a global crisis. It's prevalent in over 100 countries, affecting millions of people each year, primarily in Sub-Saharan Africa and South Asia. It's a major cause of poverty, as it hampers development and economic growth. Despite significant progress in the past 2 decades, malaria still claims nearly 500,000 lives annually, with children under 5 being the most vulnerable. The disease also poses a heavy burden on health systems, especially in low-income countries. But there's hope. Global initiatives like the Rollback Malaria Partnership are making strides towards a malaria-free world, mobilizing billions of dollars for prevention and treatment. The fight against malaria continues, and every bit of knowledge helps. Stay tuned for part 02 of our series where we delve deeper into the science behind malaria and the global efforts to eradicate it. Before we wrap up, I want to emphasize that while we've covered a lot of ground today, there's still so much to learn about malaria. This video is just the beginning of our journey to understand and combat this disease. In the coming weeks, we'll be diving deeper into each aspect of malaria, from its life cycle to the latest vaccine. Thank you for joining me today in the Victory Education Lounge. If you're passionate about making a difference, I invite you to support the fight against malaria by visiting United to Beat Malaria. You'll find the link in the description below. Together, we can help save lives and create a healthier world. Every contribution, no matter how small, brings us one step closer to a world free from malaria. Remember to like, subscribe, and share your thoughts in the comments. Together we can unveil the truths about malaria and join the battle to end this global menace. Until then, stay curious, stay vigilant, and stay healthy. Disclaimer: the information provided in this video is for educational and entertainment purposes only. Any health-related decisions should be discussed with a licensed physician. Always seek the advice of your doctor or other qualified health provider with any questions you may have regarding a medical condition.